Hi, I am Dr. Ruchi Garg, Senior Consultant in Obs and Gynae at Cloudnine Hospital, Gomti, Nagar, Lucknow. We often hear from women in the reproductive age group that they have developed fibroids. What are these fibroids and why are they so common in our women? Fibroids are basically non-cancerous growths from the uterine tissue. Very rarely they can be cancerous, especially if they are growing very rapidly. Now these are estrogen hormone dependent growths, and that is the reason they develop during the reproductive years. Once the woman reaches menopause, the estrogen hormone tapers and these growths also regress in size. The symptom complex of fibroids depends on the location in the uterus. Broadly, there are two categories. If the fibroid is on the outer surface of the uterus, it usually causes symptoms when it is more than a certain size, that is 5 centimeters. If it presses on the abdominal gut or the intestine, it will cause digestive problems, while if it presses on the urinary bladder, it may cause urinary symptoms. The treatment for these fibroids is usually surgical if they are causing these symptoms, and medicines or hormones do not really solve the problem. This surgery is always advised by laparoscopic method. Second category is of patients who have fibroids either in the middle or the inner lining of the uterus. These fibroids are notorious for causing symptoms like menstrual problems, heavy bleeding, and pain during the menses. Now, if they are less than 3 cm in size, hormonal therapy and medications can be tried and a rigorous follow-up is advised. While if they are growing in size, are multiple in number, or are causing severe symptoms, then surgery may be advised. Point to note in the surgery for fibroids is that the surgery of choice is never hysterectomy. That is, removal of uterus is not advised for treatment of fibroids. Rather, what we do is myomectomy, that is, removal of the fibroid itself and stitching up the uterus back. There are very rare subset of patients where hysterectomy will be advised for fibroids. These are the ones who have completed their families, are late in 30s or early 40s age group. They have many small fibroids studded all over the uterus, so removal of individual fibroids may not be possible. In either case, whether you are getting treated by hormones or by surgery, fibroids have a tendency to recur. So you have to be in constant touch with your gynecologist even after treatment.